Some of the studies that we did showed that the thimerosal in these biologicals is not effective. I went into a number of refrigerators and took samples of biologicals, and I found 5 or 6% or more contaminated with pathogens, and they were sitting there going to be used again. So that thimerosal is not a real effective preservative. Now the question about the use of it, why is it used, is to protect the biologicals from the poor techniques of the physicians or nurses who are going to be taking samples out of multi-dose vials. And that's the real catch there. It's a problem only for multi-dose vials, so that people going in could put something in with it and take out, come back in, take out, and you could put organisms in. And thimerosal is probably pretty well attached to the vaccine and may or may not be effective. In fact, in some of our work showed that if the thimerosal had been in there 6 months or a year and a half, the activity decreased and decreased and decreased. Now, in the single-dose vials, if it had been prepared properly, there shouldn't be any problem because they're only going to use it once. And so that it shouldn't be a problem if it had been produced sterilely.
You did studies beginning in the 1940s showing that this was a bacteriostatic agent.
Yes. Yes, that's very important. Most people don't understand or appreciate the difference between bacteriostasis and bactericidal. Now, microorganisms, unlike humans, can stay viable, stay alive, if moisture is taken away from them, if food is taken away from them, if the temperature is lowered. The organism will just lie there and just wait. And it can stay for days and weeks and months waiting for the moisture to come back, the food to come back, the temperature to be proper, and then the organism can grow out again. Now, bactericidal means that when you put the chemical in, the organism is killed rapidly. But the mercurials are very, very slow. And a lot of people don't realize that and don't appreciate it.
What initiated your looking at this in the 1940s when in fact this preservative had been around for decades before that?
Well, actually, the Council on Pharmacy and Chemistry of the American Medical Association in the 1930s had begun to get complaints and questions as to whether thimerosal was effective. And they were worried about effectiveness. And so that's how Dr. Harry Morton got a grant from the Council on Pharmacy and Chemistry to study the mercurials to see if they really were effective in the test tube and in the animal. And our studies showed conclusively that the thimerosal was inactivated by body fluids like serum and blood, and a chemical with sulfhydryl that would take the mercury away from the microorganism.
When you were planning your research projects in the 40s, when there was pressure to take a revisit at the effectiveness of merthiolate or thimerosal, you must have reviewed some of the existing literature, because we'd assume that there'd be some safety studies prior to industry ever using this as a preservative. What did you find when you reviewed this older literature? I'm
glad you mentioned that, because the same people who couldn't find my work never went back further. But there were 4 or 5 different publications, one in the developing chick embryo, another in mice, another carried out by Engley, the director of the Food and Drug Administration, to determine the toxicity of the mercurials for white cells. and they found out it was very toxic for white cells, but they did nothing about it. And based on those earlier works, we decided that we would test it in tissue culture against human tissue cells. And that's where I was very fortunate to have the opportunity in Galveston, Texas, at the University of Texas Medical Branch with Dr. Pomerat's laboratory in the early development of tissue culture methods. And so that we were able to do work on the human tissue cells. And we found out that the thimerosal was the most toxic of the chemicals, and that it would be toxic down to not grams, not milligrams, not micrograms, but nanograms, parts per billion, which was almost unbelievable, but it was true.
Dr. Engley, I wanted to ask you about the studies that predated your research in the 40s. I assume that before industry would adopt a preservative, there would be some scientific support of the effectiveness and safety of using an ethyl mercury-based product. What were the studies like that predated your assessment of the effectiveness of this preservative?
Actually, I looked for data to determine whether or not they had tested thimerosal in vaccines to find out if it was effective. I could not find any. And the work should have come from Jameson Powell of Eli Lilly. But as I almost jested, they had recommended the thimerosal for everything, but they didn't have data to prove that it was going to be effective as an antiseptic or a disinfectant or a sterilant. It wasn't there. And I looked for it.
To this date, the FDA cites early studies in the 1930s. Jameson and Powell is one of the studies that they cite as proof of safety and efficacy. And that bizarre report was published in the American Journal of Hygiene in 1931. It was a partial report on outcomes in animals. And they also cited work by Casey Smithburn, who subsequently published a report on outcomes of treating meningococcal meningitis in the University of Indiana. Are you familiar with those studies, and why would the FDA cite those as proving safety and efficacy of merthiolate?
Well, I think I might say that maybe the FDA didn't read the articles, or they didn't look at them very carefully, because there wasn't data to prove that the thimerosal was effective. And Powell and Jameson published on everything without the data. And you could go back and look at those articles, and the data's not there. They were sort of what I would call expository, thinking that, people would just accept what they said. And they even recommended thimerosal for sterilizing surgical instruments when it was known that it was only bacteriostatic. At least everybody else knew it was bacteriostatic. And then the work by Smithburn, I don't know why they ever published that, because as I read it, where they used the thimerosal as a chemotherapeutic agent in patients in the hospital with meningitis, what they said, that they gave it over a 12-hour period or less than 24 hours, and all the patients died. I wouldn't publish anything like that, because to me, it meant that the thimerosal was a toxic agent for those poor patients.
And here we have it today, 70 plus years later, citing this as some of the benchmark work that's proven thimerosal is safe and effective.
Yes, the interesting thing about the literature, if I may digress, as they say, in February of 2008, there was an article in the American Journal of Public Health by someone who was going to clear up everything about thimerosal. And I looked and I saw that his money came from the National Library of Medicine. So therefore, I thought the bibliography would be complete. So I looked at the bibliography, and guess what? I was hurt because he didn't refer to my 3 articles at all. And as I went through the article, I began to realize it was slanted toward the positive use of thimerosal in vaccines. And the interesting thing was, he listed himself as from the Department of Bioethics and History of Medicine at a prestigious university. So I looked him up, and he really was a pediatrician, and he'd been publishing on vaccines from a department that was well known as being subsidized by the vaccine companies. So this is a type of article that we're up against, where people at some universities or some departments may be prejudiced for and biased for the source of their money and their grants.
Published these 3 papers that showed very questionably that this was an effective preservative. At that time, how was that work received? Was that controversial in that days? Was it spun, or was it just ignored and buried?
I'm afraid I have to say that these reports were buried. People either didn't read them or didn't care. Even though we showed that the thimerosal was ineffective and was extremely toxic. And this was published in the American Journal of the Medical Society, in the New York Academy of Sciences, and in the Journal from the Chemical Specialties Manufacturers Association. And it didn't make a wave. There wasn't a ripple. No one seemed to care. And that, to me, you know, I said, I had done this work. I thought it was good work, and people ought to know this. But nobody seemed to care at that moment.
So certainly in 2004, when Chiron lost over half of the U.S. flu supply because of contamination with serratia bacteria in a fully preserved vaccine, that something like that event didn't surprise you?
Oh, no. There have been several reports of outbreaks of infection from vaccines that have been with thimerosal as a preservative. But many of these outbreaks or infections are never reported. I ought to know. I was chairman of an infection control committee of a hospital, a major university hospital, and it was very difficult to get the physicians to report infections. We had to resort to looking for fever, looking for a white cell count, looking for antibiotic use to determine that there was an infection, even though the state law said that thou shalt report infections. And this is one of the major problems that we face in hospital infection control, that they don't report the infections to prevent the next infections and the next.
I'd like to ask you about the safety of this and what rumors or discussions there may have been in these early years of research with regards to potential dangers of exposure in the early years for children, infants and children, to thimerosal preserved vaccines. Did you hear anything about that? Was there anything published? Did you hear anything at meetings?
There was nothing ever published real early on the potential toxicity of thimerosal as a preservative. May I say that after my 3 publications, it took until 1970 that I got onto a panel with the Food and Drug Administration to check on the safety and effectiveness of all of the over-the-counter drugs, and the mercurials turned out to be one of the groups. And it was only that time that my work came out of the closet, came out, because guess who reported it to the panel that was looking at the over-the-counter antimicrobials, such as the mercurials. But the interesting thing is that we had seen that hexachlorophene was extremely toxic, particularly in the newborns, and we recommended that hexachlorophene be taken off the market, and it was. And the next one we looked at was benzalkonium chloride, better known as Zephyrin, and we reported that it was ineffective and therefore should be taken off the market. So now we're looking at the mercurials, and in 78 to 80, what happened was the FDA was told about all of this, and they finally made up a report based on all of our facts. And they came out with a publication in the Federal Register. And as I have said, the federal what? Because most people, 95% of the people in the US of A, have never heard of the Federal Register. And it was put in there, and the only ones who really saw it were the people in industry. And they didn't make comments as they were asked to, as whether these were safe and effective. So the FDA finally came around to put another report out about 8 years later. The same thing happened. No comments. So they let it go. As I say, the paper pushers in the FDA didn't realize what was going on. And it wasn't until 1998 that they finally put the final report out on the mercurials, and people began to read it, even though we had said all the way along that it was thimerosal particularly was toxic. But they, with the FDA being segmented, the OTC and the drugs that needed a prescription, those people apparently didn't talk to each other. And the people who were involved with the vaccines didn't talk to the OTC. But I was on a group that recommended that the thimerosal be taken out of the eye products and the nasal products. And you'd think that they would have taken it out of the preserved vaccines, but they didn't. And I would say that the companies knew it was toxic. I would say that the FDA knew it was toxic. And I think that both of them knew together that it was toxic. But they probably said to each other, well, but there's nothing else. But I've said many years, there is something else. It's called freeze drying. And I worked at Penn where they developed the cryochem process, which was very effective for freeze drying. And a lot of people don't remember, and of course most of them are dead now, I guess. In 1938, the US of A collected fantastic amounts of plasma to send to the British because of the Battle of Britain, that they needed plasma. And the cryochem people and the lyophil people said, we want to freeze dry it. And they said, oh, we can't wait. So they shipped it to Britain with a preservative of thimerosal in it, and it all arrived in Britain contaminated. Now, that should have told people something, but it didn't.
So what was published in the Federal Register directed to the attention of the drug industry, the pharmaceutical industry, was the initiation of a discussion, but it wasn't a mandate by the FDA for them to remove this?
That is correct. The report in the Federal Register was a recommendation to the industry to look at the mercurial, not just for on the skin, but well, for every purpose. But the industry was not told to take it off the market.
And it finally came out from the over-the-counter products. It took, we're talking about 16 years, basically.
Just about 16 years went from the time we first gave a report to the FDA, our panel on over-the-counter mercurials. And it took about 60 years to eventually reach a point where they recommended, if not mandated, that the mercurials should be taken off the market. That's a long time. And all that time, those of us in the know knew that these things were toxic and were really ineffective as antimicrobials.
So the 1990s, there was a triumph and a tragedy all at once. We had finally removed mercury from over-the-counter products, nasal preparations, ophthalmic preparations, but to the surprise and to the occultly to many other physicians, we were increasing vaccine coverage. We were giving more children more vaccines, and through a different route, intramuscular injections, generation of children were getting a lot of mercury. So 2 steps forward, 2 steps back, in a way. In the 2000s, finally the controversy erupted. We've taken mercury out of the vaccines. That's been said over and over again, but we really haven't. The current, many of the current vaccines children are getting today, flu vaccine aside, which still has the full dose in many of those shots, they talk about trace amounts, less than 1 microgram, 0.3 micrograms. In your professional opinion, is that really trace? Is that a minuscule risk to the infant who receives that?
When they decided to take the 12.5 to 25 micrograms per dose out of the vaccines, they said that because of production methods, they had to leave a trace in the vaccines, and the trace was approximately 0.3 of a microgram. Now, the reason for that being there was because of the methods for manufacture. They used thimerosal in the, quote, unclean areas to control microorganisms. In fact, they were using it, like with the pertussis vaccine, as a sterilant to destroy the pertussis organisms gently, instead of using formaldehyde or any other chemical, or using heat, which had been used in the past for a lot of vaccines. So that there is a residual in there. And I think I have stated on occasion that, like with the Chevrolet car, unsafe at any speed, thimerosal, unsafe at any concentration. We have no proof that the thimerosal trace amount is ineffective. In fact, our work suggested that 0.3 of a microgram may be 100 to 1,000 times more toxic than the dose that we have found in tissue culture. And our work with tissue culture was very early, but this has been repeated and repeated and repeated over the past 10 years by investigators using much better techniques. And they're finding the thimerosal to be toxic down to parts per billion also.
There are a lot of other things in vaccines, and you mentioned aluminum in your lecture today. There's probably a lot we don't know, but is there anything you know of that is a concern that we could have underestimated the toxicity of mercury because of synergistic toxicity?
The only possible synergistic reaction that I know of is with the aluminum. Now, most people have no idea that there's aluminum in the vaccine, actually in the toxoid, and because it's called alum precipitated, and they haven't equated alum with aluminum. Now, the reason for the alum aluminum is that the toxoids of tetanus and diphtheria are fairly low molecular weight compared to the size and shape of the bacteria. And therefore, they've added the alum precipitation to develop what they call a depot effect, where it's injected into the muscles, and the depot effect of this precipitate, if you wish, keeps the toxoids from going out and being dissipated around the body and discarded. So that's why the alum precipitated is there. And many investigators, particularly Dr. Boyd Haley, has shown that aluminum and mercury are synergistic in their action and extremely toxic, much more than 1 + 1, which is something that many people have never considered.
Now imagine your personal doctor may have recommended a flu shot for you during the flu season. I bet you've had the opportunity to give them an earful when you get that recommendation.
Well, I have some problems being in a university town and being a former faculty member at the university. The PhD basic science types and I've used some analogies, but we are discriminated against, and even some of my, quote, former students would not like to feel that their former professor of microbiology is correct in the things he says, because they've gone on and taken clinical work and they know better. And I got news for them. They're wrong.
Today it's very easy for many of us, and journalists have covered this, to look at the overt influence of the pharmaceutical industry on healthcare policy. We see that influence at the level of federal agencies, the CDC and the NIH and the FDA. We see patent holders sitting on advisory committees, for example. Dr. Paul Offit, rotavirus vaccine patent holders are one example. We see medical organizations like the American Medical Association, the American Academy of Pediatrics that are getting direct funding from the pharmaceutical company. Ghostwriting is a major problem in the journals. It's easy to see today. Has this influence always been around, or is it just was it more difficult to see in the 30s and 40s?
I think it was more difficult to see in the 30s and 40s, but we're now dealing with larger populations. We're talking about bigger companies, and we're talking about competition. And the great American public has absolutely no idea what influence the pharmaceutical companies have on anything and everything, partly because it can't be seen. They have given money to foundations, and the foundations will give the money to the societies and to the individuals, so that it's difficult to trace the money back to the pharmaceutical industry. But a number of people realize that the pharmaceutical industry has a stable of professionals in medical schools doing their research for them, and that people don't realize that these societies are funded by the industry. And not only that, many of the medical journals will only publish positive reports that reflect positively on their vaccines. And I'm talking about full-page, multicolor ads. And that's been going on. And some people who would question the vaccines and thimerosal can't get published in those journals. And that's terrible. That's really bad. But the pharmaceutical industry goes beyond that. The pharmaceutical industry gives tremendous amount of money to all of our representatives and senators at the state and federal level. And they actually control them in such a way that it has been very difficult to get legislation passed in favor of removal of thimerosal. And this is really tragic.
What do you think we need to do going forward? What can we do to try to finally eliminate an ineffective and a dangerous preservative that is being used with increasing frequency in a flu vaccine, which it seems every couple of years the CDC adds more groups to the mix on who they recommend receiving this shot?
You know, the influenza vaccine is a very interesting one. I sat with the Armed Forces Epidemiological Board for about 10 years, and every year we were asked, along with 3 or 4 other groups, to make our recommendations as to which strains of influenza virus coming out of the mountains in Asia and coming down through the plains, which ones would be the most important ones to put in. And sometimes I refer to it like it's tossing a nickel to see which one would be better. And unfortunately, the nickel didn't come down right on some of these vaccines. Now, I'm jesting in a way, but I'm not. And so the influenza vaccine is the most difficult one. And I'm concerned about the influenza vaccine because there is a group in power at the top who are, for one reason or another, very concerned about the so-called bird flu. And it's going to come into the USA, and we need to immunize everybody this year because it might come in next year. I remember back to swine flu days that many people don't remember. It's very interesting because one of my graduate students was the one who isolated the swine flu at Fort Dix, New Jersey. And I don't think they isolated it again. There were only 1 or just a few deaths, but the people way upstairs said, my gosh, what if that swine flu sweeps the country? And so they even got to the president, and the president said, thou shalt immunize everybody against swine flu. And what they did was they caused a lot of neurological damage. Doesn't that sound familiar? Neurological damage in adults with the Guillain-Barré syndrome. And that's the best I can do with my French. And I'm afraid that that is going to happen again. But the interesting thing about my own personal immunization with the influenza vaccine, when I went to get it, my, quote, shot, the nurse was one of my former students from the School of Nursing. And I said, I want it without thimerosal. And she said, oh, well, it's only available in a single dose for children. And I said, look, at my age, I'm in the second childhood, so I'll take the single dose without the thimerosal. And so I did. I'm sure that was never reported back. But the danger of thimerosal used indiscriminately is a lot worse than people realize. Now, what concerns me now, which may or may not be pertinent, that the Gates Foundation has given many multi-hundred millions of dollars for immunization of children around the world under the auspices of CDC. So guess what? We're probably sending thimerosal containing vaccines all over the world. And as I say, they dislike us enough without them finding out that they're now getting more autistic children. But I'm afraid that's a real possibility.
Would you be surprised if I told you the president of the Bill Gates Foundation is an executive council member of IOM?
I wouldn't doubt it at all. For instance, did you know that Julie Gerberding, head of CDC, is now a member of IOM? And I was very pleased to see in the past week or 10 days that the former head of NIH is coming out of I was going to say coming out of the closet, but you can't use that term, coming out of the smoke-filled room and admitting that she now feels there's a real problem with what the various committees have recommended. And I think she sat at the top of the NIH and never knew what the groups down below her were doing. She was only getting the reports they wanted to give her. And now she's away from the NIH, and now she can speak out. And I think this is how we are going to be able to get more and more done on thimerosal and immunizations, because some of the people are coming out of the woodwork. They're coming out of the ranks. And it may take one or two, but the former head of NIH and others saying that they were probably wrong about their population studies, as she indicated in one of her interviews, that they should have been studying not 10,000 or 100,000 children or newborns, but they should test and study very carefully 300 or more of the autistic children to see what they had in common. Why are they autistic? What was it due to? And I say, well, in my feeling, it's not genetics. It's toxic from the thimerosal. Now, if I'm wrong, that it's not the thimerosal itself, I would say it's a thimerosal plus the vaccines. With all of the vaccines that are being given, in the immunology courses I took, the professor said, first of all, in all the studies we've done, that injecting immature rabbits isn't very good at all for getting an immune response. So they would use adult rabbits, and they would inject 1 or 2 or 3 or 4 or 5 vaccines, and as they added them up, the level of antibody production, specific production, went down to the point where I think they were overwhelming the immune mechanisms. And what are they doing now with all of these vaccines? I think they're overwhelming the human immune mechanisms.
What was the time frame when your studies were concluded that thimerosal wasn't necessarily safe and effective, as they were saying? What was this time frame? Is this in the 50s?
Yes,
By the time you concluded your studies?
Our first studies on the mercurials were in about 1942 or 43, and we gave a preliminary report to the Council on Pharmacy and Chemistry. I went into the military. Dr. Harry Morton presented some of our work in a paper at a national meeting as an oral presentation. And then as I finished up the military, I came back and we wrote the material up again in final form and gave it to the Council on Pharmacy and Chemistry of the American Medical Association. So that's 1948. And that was the first publication to show ineffectiveness. The 1950 report at the New York Academy of Sciences also showed that the mercurials were ineffective, but it wasn't till I had the opportunity to use human tissue culture to show definitively that the thimerosal was indeed extremely toxic unto itself and preventing outgrowth of human tissue cells down to the level of parts per billion. And even though we came out with this, it got lost. And if it wasn't for my being on the FDA panel, looking at the over-the-counter antimicrobials, I think it would have been lost until today, because it was the fact that I presented all of these papers, publications, and all of the other research that I had done to the panel for FDA, and the panel decided there was no doubt that the mercurials were unsafe and ineffective.
So we're talking a long time ago. Now, in your opinion, at this time, basically as your studies were concluded, at this time, in your opinion, was there enough proof out there as far as the safety of thimerosal to mandate an absolute recall of this preservative? If people had their eyes open to it or were willing to acknowledge your studies?
In 1972, when the panels were set up to review all of the various over-the-counter products, I was on the two groups in a row that looked at the mercurials. And the data that we had said that the mercurials, namely thimerosal, better known or worser known as merthiolate, was not only ineffective, but it was extremely toxic. And at that point, we expected the Food and Drug Administration to recommend that they be taken off the market. But for some reason known to them and the companies, this didn't happen. And they prolonged it and prolonged it and prolonged it about 16 years. And finally, everybody in every section of the FDA got the message. And finally, in '99, it was recommended that thimerosal be removed. But it wasn't removed immediately because, you know, some of the companies will say, well, we have this product that's going to go up, be finished and go out in the shelves, and really it will be out there for a year or two or three. And so they prolonged it as long as they could. And still, as we have found, there are still traces of thimerosal in a number of the vaccines. And we don't absolutely know whether it's safe. And as I've said, it's unsafe at any concentration.
Okay, one other question, I think. As far as your findings, you know, analyzing, it's very toxic at nanomolar exposures, parts per billion, basically. Can you tell us what your findings were and how, you know, kind of in a layman terms, tell us what you saw? I mean, was it there's cell death? A little bit about what you saw as far as it's toxic, but what was it doing to, you know, to make itself known as toxic?
In doing tissue culture work, there are a number of tissues and there are a number of different types of studies that can be carried out. The one that I used was taking a bit of tissue and growing it in the laboratory in such a way that when we could add nutrients, it would grow and continue to grow and continue to grow. But if we put thimerosal in the culture medium for it to grow on, the cells did not proliferate, they did not grow out, and they stopped growing completely. So this we used as our indicator of toxicity. And just recently, as I reviewed the work that I did in 1956, or published in 56, but done in 1953, 54, I realized that if I had exposed the tissues to the thimerosal before I had put them into the culture, that the toxicity probably, most probably, would have been even greater than I observed. And we're talking about infinitesimal amounts that they're very difficult to measure.
Your thoughts on the recommendation for pregnant women to get a flu shot?
Get mercury from the flu shot.
Right, the 25 micrograms in the flu shot.
Yeah.
Pregnant women receive.
I think the recommendation giving the influenza vaccine containing 25 micrograms per dose to pregnant women is uncalled for. There are enough problems in pregnancy, and it's been shown that the pregnant mothers-to-be who have received the Rh gamma globulin containing thimerosal have resulted in children with autism. So there's absolutely no reason for having the thimerosal in there unless they've got 1 million or 2 doses sitting in and they just want to use it up. And by the way, the vaccine that's available this past year was probably only about less than 40% effective. So that the big question is, should they be given any at all?
What would you like to say as far as those who are picking up the fight with the toxins in the end?
Well, you know, after being on the FDA panels and turning in the report, which we thought was going to take care of everything, it turned out that it wasn't taken care of. And it wasn't until about 3 or 4 years ago that someone contacted me and said that they had found the original work from the 40s and 50s. And did I know that it was the first publications? And so I had made contact with these people, or they with me, and so that we've had a continuing relationship. And fortunately, the people like Mark and David Geyer are able to keep going through adversity and adversity and adversity, where they have been at the forefront of people saying that they're wrong. But the truth is that the Geyers are correct in all they're doing to do something positive for autism and autistic children.
What role do you think it's playing in adults getting flu shots and elderly getting flu shots? And what role do you think it's playing in some of the adult illnesses? Or do you have an opinion on that?
Well, since the influenza strains may change year by year by year, it has become the recommendation that the adults get the newer, better influenza immunization each year. But there is a question about whether or not it is that desirable for everyone to receive the vaccine. For myself, I don't think it is absolutely necessary for that when we're talking about the influenza vaccines. But as I've been thinking about and concerned about people at the top talking about the need for hundreds of millions of doses of bird flu vaccine, and there's no evidence that it's going to get here. But here goes another set of neurological problems with all of these people.
That vaccine is going to contain aluminum with it. The current flu shots do not have aluminum in it. But
No.
The H5N1 will have aluminum. And I understand at least one company is making it with twice the mercury that the current flu shots have. 50 micrograms.
50 micrograms of thimerosal? An American company?
I don't know. I don't know. I don't
Well,
know which company. Have you heard that? Yeah.
But I find it interesting to hear that the influenza vaccine will contain some aluminum or alum precipitate. I can see why. Because if they're not getting a high dosage percentage result in immunization with the vaccine as it is now, they want it to be more of a depot effect with the alum precipitated, which is the first time I've ever heard them wanting to do that. But I can see on paper and pencil why some people would recommend that. But I think that that's going to be fraught with hypersensitivity and allergy problems of having the depot effect.
Go back to the question I kind of just asked. Do you think the mercury in flu shots has anything to do with Alzheimer's and the rise in Alzheimer's from the elderly getting flu shots every year?
I'm not able to say whether the mercury in the flu shots given to elderly people might have some effect on the Alzheimer's disease process. I have no way of knowing. However, I think that's a good place for a good study, scientifically designed to be carried out using good statistics. I'm always concerned about statistics. What was it Mark Twain said? There are lies, damn lies, and statistics. And a friend of mine for Boeing Aircraft, who was into all of the statistical analysis, at breakfast when I was telling him about the problems with the population studies and that the results didn't show anything conclusive. He said, well, you tell me what you want and I'll write a program for it and we'll get the results. So it just goes to show that if you want, you can show what you desire, which is a terrible thing to say.
Why do you think scientists such as Paul Offit are saying that there is no toxicity in mercury or thimerosal? Why do you think that they're not admitting the link, acknowledging the link?
The question arises as to how can some of the so-called medical scientists say that thimerosal isn't a problem. It comes back to the fact that they're in such a position that they can't dare admit that thimerosal is a problem because it reflects on their background and training and medical expertise. And if they would admit that it was a problem, it would open the door to a tremendous amount of legal activity. And that's why, from the industry point of view and from the obstetrician point of view and the pediatrician's point of view and the vaccine advisory committees of pediatrics, that's why they've all stayed the course. Because if somebody breaks out or breaks down and says, well, you know, thimerosal it's a problem, then everything that they have said for the past years goes up as a question, as a lie. And some of these people fit into the category, if you don't understand the situation, follow the dollar, look for the money, and you find out where these people are getting their support for their research or getting a consulting fee or just being outright paid, all of the above. And I'm afraid that there are a number of those.